Welcome to the Animal Training Fundamentals podcast, where we have fun with practical application and we get mental with the science of behavior. Put them both together and you get results, solutions for your behavior problems, and the tools you need to achieve your training goals. I'm your host, Barbara Heidenreich. Let's talk training. Hey, before we get into this super cool podcast, I wanted to ask you, do you like free educational resources? How about supporting small independent businesses? What about women in business? Are you a fan of animal training, animal welfare, maybe the zoo community? If you are, there's an easy way to show your love. All you have to do is rate and review this podcast. Even sharing this podcast is a great way to show your love. By rating, reviewing, and sharing this podcast, it actually helps it reach more people. And it's pretty easy to do. However, if you're not sure how, I've actually created some resources that show you how to do it. Go to animaltrainingfundamentals.com/podcast, and you'll see instructions that will show you how to access the rate and review pages from your phone or from your computer. And guess what? It gets even better. Every 6 months, we're going to select from our reviewers somebody who has an opportunity to win a free membership to the online education program, animaltrainingfundamentals.com. That's pretty cool. It's our way of saying thanks for your support. Okay, let's get into the podcast. Hey, everybody, it's Barbara Heidenreich here, and I have two special guests with me. I have Dr. Alicia McLauglin she's a veterinary manager, I should say, from the Center for Bird and Exotic Animal Medicine in the Seattle area. And I also have Pamela Clark, and she is a certified parrot behavior consultant, and she's also a retired veterinary technician. And along with Dr. Anneliese Strunk and myself, are all co-authors of the Fear-Free Veterinary Certification Program for people who are interested in working with birds. Now, Dr. Anneliese Strunk isn't here with us today, but you've got 3 of the 4, and we are going to talk to you today about this wonderful Fear-Free program and what it's like to work with birds in a way that you can provide fear-free veterinary exams and all those wonderful things that you want to do with birds when you're trying to do their health care. So welcome, Dr. McLauglin, and welcome, Pam Clark.
Thank you.
Thanks, Barbara.
So why don't we start with the two of you telling us a little bit about your backgrounds. Do you want to start, Alicia?
Sure, I'm happy to. So I graduated from vet school at Oklahoma State University, went straight into exotics practice, and have continued in an exclusive exotics caseload ever since. Really am fascinated by the variety of patients I get to see, and it's really wonderful. And one of the things that I'm really passionate about is parrots and other birds as well. I really am amazed at how smart they are and how how interesting their behaviors are and how closely they bond with their humans. And it really was something that I really wanted to see an improvement in how veterinarians handle these animals whenever they're seeing them at their hospitals. And because I have heard so many times that veterinary visits are scary and stressful, and I'm really excited about having a course be created so that we can try to help change that moving forward.
Awesome. And Pam, you have a very interesting background with parrots. So why don't you tell us how you got into the world of working with birds?
Sure. I became fascinated with birds from a really early age, but what really fueled that was when I was in a pet store when I was about 18 and met the gaze of an African gray parrot that was sitting on a perch. And I was just enchanted. And ever since then, I've been fascinated with them. And so I've done a lot of different things with parrots. I worked for 2 Avian veterinarians, really excellent vets, as a technician. I've trained parrots quite a bit. I've trained birds, a couple of African greys in outdoor flight. I've done a lot of fostering. It's just fascinating to me to take in a bird that people have deemed impossible and get it on a better diet and then resolve its behavior problems and find it a new home. And then I've worked as a parrot behavior consultant for about 25 years, and I publish a blog as well that people have said is really helpful. So and I guess I would like to follow Alicia also by saying that working as a technician, I too became a bit uncomfortable with some of the ways that we handled birds. And I was very excited and honored to be part of this project so that hopefully in the future, all avian patients will have a much better experience when they go into a veterinary clinic.
And I should add, both of you also live with companion parrots, right?
Oh, yeah.
Oh, yeah. I have 2 white-bellied caiques and a blue-throated macaw that I rehomed from a client who didn't want her anymore once she became very aggressive and reproductively active. So they're super fun, and I really love them, and they're part of why I do what I do.
And I have a Moluccan cockatoo who's 44 years old, if you can believe that. And I have 7 African greys, 2 Amazons, and a cockatiel. So it's quite a lively household here.
I know. Pretty quiet at the moment, though, I have to admit.
Yeah, they are. It's a good time.
Yeah. No, and I still, well, now I'm just down to 2 birds, although at one time I had quite a few, but over the years they've passed on. But just my 1 Amazon parrot and my blue-throated macaw, or just my blue-throated macaw. That's it at this point. So, but yes, they've been a part of my life for a long time as well. All right. So let's get into this fear-free medicine. You know, we hear that word a lot now, but what do you guys think fear-free medicine means exactly?
Well, fear-free medicine is practicing medicine in a way that puts the emotional well-being of the patient on the same level as the physical well-being. And basically, we're not just, if you're practicing fear-free medicine, your focus is not on just fixing the underlying health problem. It's doing it in a way that's sensitive and accommodating to the animal's individual emotional needs and behavioral needs. And it's not doing it in a way that's unsafe for veterinary team members or the patient or anything like that. But there's a whole way of approaching animals that focuses on trying to provide them with more choices and focuses on trying to provide them with more of an experience that they have some level of control and enjoyment over. And it's not something that has to be super complex, but it does require a mindset shift from what veterinary medicine has often traditionally tended to be. And there's a lot of different reasons for that. And some of them are out of the control of the situation. People have expectations of, you schedule a veterinary appointment and you are in and out in 15 to 20 minutes, for vaccines. And that's not something that you can really do with focusing on the emotional well-being of the pet. Some of it has to do with, it's a learned thing. So if you are doing veterinary medicine and you learn from a mentor that practices in a certain way, you're likely to do the same thing moving forward. And behavior medicine and interpreting animal body language is a topic that traditionally has been very poorly taught at veterinary colleges. It is becoming more common to actually teach those topics, but it's not one of the focuses, which, to be fair, you only have so many years to cram a whole bunch of things about all the different species in the world into. So that it makes it really tough, but every animal has behavior and every animal has a brain, and we should be focusing on that as part of what we are doing. And so it's been a movement that has been building over the past decade or so, to just trying to change what our focus is. And it's not that the physical aspects of what we do aren't important as well, but it's just adding an extra set of considerations.
So I think the question a lot of people might have is it really possible with birds? I think people sometimes think that, oh, there's no way my bird is going to relax at the veterinary clinic. So what do you think? Is it really possible with birds?
It definitely is more challenging. There's a lot of different aspects to why it can become a little bit more difficult with birds. Some of those things are related to just kind of the mindset that a lot of parrot owners and bird owners have had of you only go to the vet when they're sick. So if the only time the bird is experiencing veterinary care is when they're feeling really bad, it makes it, they're not going to be as willing to accept reinforcers, and you have to change how you're handling them because birds can be very, very delicate when they're sick. And they're not going to necessarily retain good memories from those experiences. So there's factors like that go into it. A lot of birds aren't getting great socialization or training at home, which can also complicate it. But I think a big part of it is just we've had this idea for a very, very long time that visits to the vet are stressful for birds, period. There's not been really an attempt to minimize stress. It's just been, well, let's just get it done as quick as we can and then get them home, because we know they're high stress and we know birds can have really bad reactions to stress, and we just don't want to mess with them any more than absolutely necessary. And I think what we're finding is we're trying to kind of push the boundaries of what has been done, and a lot of avian vets have been moving this way for a long time. It's just not something that's always well publicized. But if you're paying attention to bird body language and moving slowly, a lot of times you don't need to do the forceful things to get things done. And people like you, Barbara, and Pam, who've been really pushing the training aspect of cooperation with veterinary care and zoo facilities and with private pet owners, has really made a huge difference, I think, in what we as veterinarians see as possible. Because it's hard to know that you can do better until you've seen someone else, do it as well. So I think it's definitely one of those things that we're going to see more of in the future. And I think it's really exciting that there's getting to be more resources for people who are interested in trying to pursue this. Pam, what would you say?
Well, I loved both your answers, Alicia. I think that whether it's possible or not rests quite a bit in the hands of the parrot owner, because that's something else that characterizes fear-free medicine, I think, is that the owner of the parrot becomes much more a partner in the experience, as opposed to the typical more passive type of experience that they have. And so the more training, the more they understand body language, the more training that they do, the more possible becomes that fear-free experience, and the better the relationship the person has with their bird as well.
Maybe you can talk about a few of those behaviors, Pam, that some of those people could do with their animals at home, especially companion parrots.
Oh, absolutely. The first thing that they could do would be to teach a bird to target, which is really easy to teach. And then you could even bring that target in with you to the veterinary clinic so that you could ask for a few behaviors, ask the bird to target in the vet clinic, which might put him more at ease. You can, using a target, once a bird knows that behavior, you can easily teach them just to walk onto a scale, which then becomes something that they can do when they come into the clinic. So they don't have to be put into a metal basket to be weighed. There's no struggle in achieving that bit of data at all. They can teach their parrot to be relaxed in a towel. They can teach a parrot to just stand for an all-over exam of the body. There's really no limit. You can teach a bird to accept injections and inhalant anesthesia. So, I think the extent to which owners will pursue this type of training will differ from person to person. But with my own clients, once I really shifted my focus, so that I was focusing on both wellness and training for the birds who come to me, with their clients. I found that a lot of those people really love training. They start with targeting and then they go on. And I think that training can be intimidating for people in the very beginning, the idea of it. But if you coach them, mentor them, and help them, they can really go a long way. I've been impressed. I really have this year.
One thing that you hadn't mentioned, Pam, just that I would like to add with that too, is just even training birds to get into carriers.
Yes, exactly. Yes.
When I'm doing blood work on birds, most of the time I'm seeing them having elevations in their muscle enzymes and changes to their blood work that show that they've undergone a fairly significant stress just with getting to the veterinary hospital. And, it's one of those things where, I've had people tell me, I couldn't get my bird into the crate, so I couldn't bring it into the veterinary hospital. That can impact their ability to receive treatment. And so if you can make that process of getting into the crate, getting into the car, driving to the veterinary hospital not be such a scary thing, you're also going to get more accurate lab results. You're going to get more a bird that's not already coming into the vet clinic super ramped up and over threshold and really scared. It can really change the whole dynamic.
Yeah, I'm glad that you mentioned that. And I'd like to add that it's an easy thing to train also. It seems so intimidating, but if you have a bird who targets, it's easy to teach them to go into a carrier on cue.
And my favorite one to add on to that is teaching them to take fluids from a syringe in case you have to take oral medications. Yeah, one of my favorite ones.
Every bird is going to need medications at some point in their life, almost without fail. And that's just such a huge thing. I've had patients that were diagnosed with life-threatening illnesses that we ended up making treatment decisions that really weren't best for them because of an inability on the owner's part to medicate and an unwillingness to train. And I've had owners who have already worked with teaching their birds to take medications with a syringe, and it's just a completely different situation when their bird has heart disease or something like that, because it's actually a really awesome bonding experience. You get to spend time with the bird every day, and the birds love getting the attention and the medications. We can flavor the medications and make them taste great, but just that whole mindset change of not, I got to medicate the bird now. It's, I get to medicate my bird now. It's great.
It was always one of my favorite behaviors to demonstrate and have people practice when I was doing the live parrot training workshops, because you usually could train it in 1 to 2 training sessions. So when we're talking, a 5 to 15-minute training session. So it's pretty easy to accomplish, and definitely one, like you're saying, train it before you need it. And there you go. You have a behavior that's ready to go if your bird gets sick. So a good one to add to your list. And yes, we do go over it in the course. Okay. So
all of those, of course, actually.
Yeah, I think most of the ones mentioned we do go over in the course. I did want to say, if let's say we are in the situation though that the bird is not trained, we do go over that as well. Now, obviously, this is just a podcast, so we're not going to talk about everything that's possible. But there are some alternatives if a bird is not trained. Let's say you get it, and obviously those situations do happen. But there are some alternatives for those birds as well. Correct?
Absolutely. So one of the biggest things is whenever you have a bird, regardless of whether they've had training or not, you need to have a group of professionals that are working with you with the bird who are familiar with bird body language. So a sensitivity to what a bird is saying with their body, both their posture, their vocalizations, how they're holding their feathers, what's happening with their eye position and appearance, and all of that can make a huge difference in how an animal is approached and how you move through different procedures, knowing what that individual species prefers as far as how their body should be handled, and trying to minimize the or change how you approach in terms of if you have a part of the body the species really doesn't like being touched, doing that last and doing the rest of the exam first, so the bird has a chance to kind of acclimate to, hey, this isn't so bad. Just being considerate in general just makes a huge difference. And birds really respond well to gentle, slow approaches to their body. There are certain things that, certain parts of the veterinary exam that are likely going to require a little bit of restraint, but there are also ways to provide restraint in a minimally intrusive way. Not every bird needs to be in a towel. There are definitely some birds that do, but it is also very common for us to be able to do a lot of the exam and even collecting diagnostics with minimal usage of a towel or very non-obtrusive uses of a towel. I really want to see people moving away from the harpy eagle swooping down with the towel to catch the bird. If at all possible, there's so many different other ways that we can get birds restrained and do it in a less scary way for the bird.
And a lot of people are really apprehensive about sedating birds. And, there's been a lot of talk about that in the past. And I think that's really changed a lot in recent years that maybe a lot of clients don't know about. Do you want to maybe help put them at ease about sedation?
Sure. So, for a long time, there haven't been as many good scientific journal publications necessarily addressing safe sedation options for birds. And some of the older types of anesthetic agents that were used were not necessarily as safe as they could be, and birds don't respond to anesthetic agents in the same way as dogs and cats. So there's some drugs that you really wouldn't want to use in a bird that would work just fine in a mammal. But there are some really, really great, safe, fully reversible sedation options available nowadays that we use on a regular basis at my clinic, and I will say, has totally changed how I practice medicine. The two big ones that are used the most frequently with birds are midazolam, which is a benzodiazepine in the same class of medication as Valium, and then butorphanol, which is a opioid sedative that also provides pain relief. And the combination of those two medications, or used, midazolam can also be used as a sole sedation agent. But you can administer them intranasally, you can administer them injectably, which birds can tolerate both of those administration routes very, very well. And you can get a very good plane of mild sedation where if you're dosing it and titrating the dose to the patient, you can have a bird that just doesn't have that same level of anxiety and fear that they were experiencing previously. And they're able to be examined with minimal restraint. They're able to have diagnostics collected with minimal restraint. And one of the nice things about midazolam is it does have some amnesiac properties. So it can kind of blur the memory a little bit of an aversive situation. So if you had a bad experience getting the bird into the car or into the carrier or something like that, it can make it a little less bad for the bird in its recall later on, which can help you with training moving forward if you don't have a really horrible fear memory to try to overcome. And those medications are able to be reversed by another medication, which makes them very, very safe. And they typically only last for, somewhere, I would say the average is around 1 to 2 hours. I've had a few patients that it seemed to, if we didn't reverse the medication, it lasted a couple more hours than that. But your average bird, it's fairly short lasting and works really well and can just totally change the experience. And you can use, I've heard it called bruticaine, where you just hold an animal down by brute force and just get it done. And that's definitely something that people have done for a very long time. When you have to get blood, you just hold the animal still, whether or not the animal wants to. But there's really no need for that. you can change the experience of the animal by taking away that fear with that anti-anxiety medication, and just totally change the entire experience. It also, just can make the recovery a lot faster if you don't have the fear involved with everything. I don't tend to see as many issues with, I've heard so many people say, my bird hates going to the vet, and then they hate me for the next several days because they were mad at me because I got them in the carrier. And I don't tend to hear those types of reports when we have sedatives involved. And it can make things really safe too. Sometimes if you're doing a blood draw on a really tiny bird, having them being wiggling or having their blood pressure through the roof because they're really scared really isn't a safe scenario. And you can get really super valuable diagnostic information if you and do it safely if you use some sedatives. So there's some cases where it really is just a safety issue too.
And it's also delivered intranasally usually, is that correct?
You can give it either intranasally or injectably. The intranasal route, some birds will sneeze when you give it in that location, but it's nice because you don't have a needle injection aspect to it. Although I will say birds tolerate injections pretty darn well. It doesn't seem to be, as long as you're using a small gauge needle, they often will tolerate that quite well. Biggest difference between intranasal or injectable administration is sometimes where the bird is most sensitive to. So if you have a bird that's really nervous around you approaching their face, probably I would prefer to do an injectable route versus the intranasal. And depending on how sleepy I need them, I might choose injectable over intranasal, because intranasal is usually they're still standing. They're still, sort of aware of their surroundings. They're just really drunk. And the injectable version, they're going to be sleepy enough that I can position them for x-rays, or, it's going to be very, very a deeper plane of sedation. So, but both of them are, regardless of where you administer or how you administer the medication, both of those routes of administrations are reversed by the same medication. So you can administer another medication intranasally and have them come out of sedation within 5 minutes.
So Pam, what are things that happen when the bird first comes into the clinic that can be done to help ensure a more fear-free visit to the clinic?
Well, I think having a quiet practice is important. I know that the first practice I worked at, it was just wonderful. We were supposed to be quiet. And, we did what we could to stop barking of dogs. So, we spoke quietly to each other. And so just having a calm and quiet atmosphere in the clinic is helpful. And then making sure that the carrier is carried in a stable fashion, maybe with two hands, so that it's not swinging around and putting the bird off balance. During the check-in period, it's helpful if you choose a quiet area or get checked in to the exam room. Some clinics do that. But during that process, you want to make sure that you put that carrier up high. Birds feel safer up high. You don't want to set it down on the floor. Covering the carrier with a towel can help put your bird at ease as well. All of those things are helpful. And then, everyone involved, the receptionist, if a vet tech is there, the owner should be keeping an eye on the bird's body language and responding to that appropriately. If there's some sort of stimulus in the room that's making the bird nervous, you might want to reposition the carrier or something like that. Block the bird's view. I don't know, but there's a lot of very subtle things that can be done to ensure that the first few minutes in the clinic are those that don't upset the bird in any way. I mean, the goal is to keep the birds below threshold, relaxed as possible. And so all of those things will contribute to that goal.
Yeah, I think we sometimes forget that birds perceive the world a little bit differently than dogs and cats. And one of the things we talked about a lot in our course when we were developing it was looking at the room from the bird's perspective.
Right.
And things like having those blinds open and the flash of lights of cars going by and the reflections that can happen from different things might create a response in a bird that you wouldn't expect maybe a dog or a cat.
Yeah.
So there's so many little factors that are so different when a bird is in the room compared to a mammal, that's for sure.
No, absolutely. At the second clinic where I worked, it just drove me crazy because the avian exam room, we saw dogs and cats as well, but the avian exam room was located right next to the door to the treatment area. So that door was constantly banging shut. And we also had clinic cats that would wander into the exam room if the door wasn't shut. Things like that, really need to be dealt with through management channels to make sure that the bird and the owner are really set up for success when they come into the clinic to have that visit.
Yeah, I remember another thing we discussed was the difference in working with flighted birds versus non-flighted birds.
Yeah.
Little things like, I don't know, a picture frame on your shelving that a potentially flighted bird may try to land on, and then the next thing you know, that thing falls over. That are, again, things that you may not be thinking about if you're not accustomed to working with birds. And so all these things are small details that the person who is accustomed to working with birds might be thinking about, but somebody who may not have worked with them before may not be aware of. And all those little things can escalate. And so taking a bird out of a carrier, thinking that, I just want to let the bird hang out and be comfortable, maybe setting that bird up for a situation where we escalate fear responses because the bird may end up flying around in a panic flight. So all these little details that we think about as bird people.
That's right.
I think one of the biggest differences, in my opinion, from what we're dealing with birds compared to dogs and cats is I feel like there's a lot of things that we have to be thinking about way far in advance, and we need to be doing a lot more planning. So I feel like with dogs and cats, there's a lot more, for fear-free visits even, there's a little bit more flexibility. You kind of get into the room and you're like, okay, how is this dog or is this cat, behaving? What do we need to adjust for this individual patient? And it's a little bit less of a, okay, now we have to plan this whole experience from start to finish. And if we get it wrong, we've just set ourselves back and we may not be able to get the bird back under threshold, because once a bird goes over threshold, they're not going to be taking treats. They're not going to be, responding in the same way. And it can take hours or longer for them to come back down from threshold. So it's just very much you have to be a lot more sensitive if you're working with birds than you would be necessarily if you have a dog who might be a lot more forgiving. A bird's not going to necessarily be okay with your mistakes. And so there's prep work that has to be done in advance. If you're going to do a procedure, you also don't want to be having the bird in hand for any longer than absolutely necessary. So you have to have all of the things with procedures set up in advance. You have to make sure you have all of your tools available, that you've thought of all of the contingencies for what could happen. Even if it's over preparation, it's way better to be over prepared than under prepared. And the same thing with your exam rooms. And then the other thing is just being able to change things on the fly. You mentioned picture frames being a potential risk for flighted birds. I've actually had one of my patients who hates one of the pictures in our exam rooms. And the bird will start doing alarm calls if it saw that picture. And so we actually have to either use a different exam room for that bird, or we actually take the picture off of the wall and hide it until the appointment is done, just because that's enough to set the bird off. And we only figured it out by getting down on the bird's level and what are you looking at? It was really hard to figure out because, birds kind of tilt their heads in weird ways whenever they don't look at it straight on. They don't have binocular vision in the same way people do. So it can be a little challenging to figure out what are you actually looking at? But sometimes it can be little things that you wouldn't ever think would actually affect them, and it can make a huge difference. And just moving a fraction of a speed faster. You slow down just a little bit more, and that's the difference versus moving just a little bit faster. It startles them and you're done.
Yeah. And a lot of times people may not realize that their bird is going to act differently at the veterinary clinic because they haven't been there before, or they just assume maybe the bird's going to behave the way it did at home. And so you don't know what to expect. And so you kind of, as Pam was pointing out, it's as the person at the veterinary clinic, the veterinary professional, it's kind of your job to help set that person up for success as much as you possibly can. And so a lot of times it is telling people, we're not sure how your bird is going to react. He may behave this way at home, but he may not do that here. So we're going to do our best to help him have success by doing X, Y, Z.
I have a lot of people who are really convinced their birds are going to have a bad experience at the vet. So there's no point in trying. So I'll be moving slow and they're like, just get it over with. Like, don't waste our time. Don't waste the bird's time. He'll be fine. He's used to it. There's all sorts of excuses that I hear. And it's just because that's their expectation and that's what they've seen in the past. So it's understandable. I get why they say it. But I've definitely had birds where they're like, oh, he'll definitely bite you and you can't do anything with this bird. And I've been able to safely examine and do things with a bird that was perceived to be unsafe by other veterinarians in the past, just because I was paying attention to what they were telling me with their body language, not what the owner was necessarily telling me. And given a different scenario, that bird very well may have been aggressive and we may have had to change the approach. But it's a hard balance because there's so many different things that go into this, and it's not just, well, my bird is this, and so that's how he's going to act. We don't, labeling behaviors isn't usually helpful from a standpoint of, oh, my bird is mean, my bird is this or that, and always will do this. Well, it just depends on the scenario.
We're going to take a little break to give you your first secret word, and the secret word is sedative. Secret words are important to remember and submit for members of the online education program animaltrainingfundamentals.com to show that they've listened to this podcast for their professional development. And we're going to get right back into the program.
I thought of something, Barbara. We're using the words reinforcers and treats, and the fact that if a bird gets over threshold, he may not take a treat. But we haven't really said anything about positive reinforcement and its use. So can you address that a bit about the fact that that's the foundation for fear-free medicine, a lot of it?
Well, I don't know. Maybe they need to take the course.
So maybe we shouldn't.
We'll address that in the course. We go through a lot of
because there's a lot of stuff in there. We might not have time to go into all those definitions here. Yeah, I will say one of the things that I'm pretty proud of with our course is that it's certainly a standalone course. They can take our entire course and definitely learn all those definitions and be able to have a pretty good foundation in fear-free medicine in general, I would say, not just as it pertains to birds. So yeah, we do go into all the different principles and procedures that could be applied to birds in order to train behaviors, as well as to introduce objects that may introduce, that could potentially create a fear response. And we talk about some other techniques that could be used to address fear responses, even if the animal isn't receptive to food or touch or desired items. And it's all about doing it in a way that is non-coercive. So that is our objective, again, because this is about trying to create animals that are comfortable and relaxed as much as possible. So yeah, I don't know that I'd have time to define all of those. So we'll encourage them to take the course and learn all
Very
that.
good.
Because how many modules are there? What did we do? I
think 9.
9, yeah. So it's a pretty in-depth course. It took us 2 years to create it. So it's definitely pretty full of information, that's for sure. And I should mention, we keep talking about parrots here, but it's not just parrot focused. It's definitely covering other species as well. So I'll let you guys go at it. What other species will this help them with?
Well, we primarily, a lot of the stuff that we focused on was parrots, but we definitely addressed poultry. We talked about columbiformes, so pigeons and doves. We talked about birds of prey. We talked about passerines, so our little tiny canary friends, and songbirds and that type of thing. We talked about turacos in the course. There's a fair amount of stuff that's covered, and our goal is basically, we can't it's impossible to go through and explain in a single course all the different species and all the different variations. But the hope that we for the species that we provided was at least so that you could kind of get a feel for what cross-species application of these principles would look like. Because if you've only ever seen it done in one species, it's a lot harder to imagine how you could then take it and move it to a different species. But if you've at least seen it with a couple and been like, oh, they changed that and they did that differently, then you can look at the new species and kind of extrapolate from there. But we go pretty in depth. We've got a lot of videos in the course just of various procedures being done in a fear-free manner. We have videos of raptors getting exams, pigeons, canaries, chickens, ducks, lots of different, how ways you can do procedures and how different species might prefer a procedure done in a particular way versus another, how they prefer to be positioned for exams, what are the least irritating parts of their body to touch and the most irritating parts to touch. So all of that's covered in the course. It's pretty in depth for those groups of birds.
Yeah, and I also like that, and maybe Pam, you can speak to this about some of the things that are directed towards some of the other staff involved, like some of the responsibilities of other people in the veterinary practice.
Oh, absolutely, because the entire practice has to work as a well-oiled machine, That should be the case no matter what in any veterinary clinic, but it's especially necessary if you're practicing fear-free medicine. It's important that since some of this information may be very new to clients, it's especially important that every staff member has the same message so that owners will hear the same thing over and over and become more comfortable with it. The receptionist has a role. As soon as that bird comes through the door, she knows that she needs to get that bird checked in as quickly as possible. And also just take a peek at that bird's body language. And if there are any issues at all, if that bird already appears over threshold, she can call a technician, get the bird and the owner into a room immediately. So she's the first one who helps to ensure the bird's comfort during the check-in process. And then while she's doing that, the technician would be setting the room up, because birds can be frightened just if you move something across a counter. So in preparing for the appointment, the technician would put every single thing that was anticipated being needed out where it should be, where it would be used, and then the room is closed with a tag that says it's in use, so nobody can go in there and usurp the use of the room. The technician also is critically important in many cases in terms of taking a history from the owner, especially gathering information about previous fearful experiences at a veterinary clinic, what the bird enjoys in terms of reinforcers. I mean, the questions that technician asks and the skill with which she asks them really sets the veterinarian up for success. And then, of course, the vet has the most important job of all, making sure that diagnostics and the exam and treatments are all provided in as stress-free a manner as possible. Is that what you were thinking about, Barbara?
Yeah, for sure, because you really helped develop a lot of that part of the program, and then you also even had follow-up, as I recall, too.
Yeah, absolutely. And again, the technician can be vitally important in this. Vets have a really, really hard job, and a good, well-trained technician can take a lot of the weight off of their shoulders, because the technician can do the entire period of follow-up. And when I was working as a tech, I just made it my responsibility to put a call back in for 2 days. Then I would make the call, check with the owner, see how the bird was doing, in all ways, and then try and further that owner's understanding of what training might have been suggested, coach her a bit in terms of providing that, kind of assess her interest in further follow-up. Some clients, they just don't want to have anything to do with it. Others just can't get enough information. So other follow-up calls could be scheduled as well to help coach that client depending upon her interest.
Yeah. So I know we've talked a lot about things that maybe veterinary professionals could do to help facilitate a fear-free exam or fear-free visit. But I really feel like this course also could be beneficial to people who aren't necessarily veterinary professionals. What do you guys think?
Absolutely.
Yeah. It's really, there's the whole last couple of modules are really focused on just different training protocols and how you can alter them for individual patients. And really the whole, I think Barbara's work with zoos and getting animals to cooperate with medical behaviors has been really inspirational for me, at least, just seeing what animals can actually do if given the training. And there's a lot of things that are covered that are, just letting people know, hey, you can train this, and this can make a big difference for your bird's quality of life. So we really need to be able to partner with bird owners, and you've definitely got people in zoological facilities who are totally on board with this and really working on this already. But we need to get bird owners on the same page with, there's things that you can do to help us do our job better and have your bird have a better experience. And some of those things are, kind of basic, like don't wait until the last minute to bring the bird to the vet, have regular exams where your bird can both have kind of some healthy baselines that are known at the vet clinic of this is what my bird is like when it's healthy, but also having those opportunities for training and just having the bird see, hey, every time I go here, bad things don't happen. Having those training protocols done at home so that when the bird gets sick, it's not a disaster for everyone involved. You can have some behaviors to fall back on and help make sure the bird gets the care that it needs. Just really kind of redefining that whole attitude and persona that's been in bird ownership for a really long time. I think it's really important for people who have birds as pets and who work with birds in any manner whatsoever to just really see this type of information and kind of challenge some of the preconceptions, because it's definitely I'm always one of the things that I really like doing with my patients is saying, well, this is what we have. Can we do better? And I feel like the way I practice medicine today, I'm going to be horrified by in 10 years. I really hope that that's the case, because I think that as a profession, we should always be striving to do better. We should always be making changes based on the available science and what we learn and our experience. And I really hope that this course is just one step along that pathway to even getting better. And I'm really proud of what we've put together, but I think it's going to be one of those, I hope it's going to be one of those things where in 10 years we look back and we're like, oh yeah, everyone does that. Everyone trains their bird to take meds from a syringe. Who are you talking about? It's the dark ages when that didn't happen. So I'm really hoping we're going to see some change there.
And I'd just like to add too that, it's the owners, the caregivers who are going to demand this change. And in order to do so, they need to know what fear-free medicine looks like. And so you get a good idea when taking this course of exactly what it would look like, what things would happen and should happen when you get your bird into a veterinary clinic. That way you can assess how well your practice is doing. You can make suggestions. Again, you're the consumer. And as consumers, we can ask veterinarians to do better as well. And so by taking the course, not only would they have access to all the training protocols, as you mentioned, Alicia, but they get just a wealth of information about what goes on within a veterinary clinic and, what they can demand for themselves and their birds.
Very well said from both of you. And I have to agree as a as a bird owner, and a professional that works out in the industry as well, but not a veterinary professional. I learned a lot from both of you, and I felt like, yeah, I wish everybody knew this information. And I think that's a great perspective to have, as you both have mentioned, that everybody who works with birds or has a bird should know this information. And so that's the way I took it as well, that you don't need to be a veterinary professional to take this course, that you as a person who has a bird or works with birds, you want to know this information so that you can make sure your bird is getting the proper care and that this is what's possible for your bird. So I agree with everything you guys said. That's really fantastic. Wow.
And it's really great as a veterinarian just to be working off of the same set of definitions. We don't have even time is such a valuable thing, and there's so many things that we're having to cover in every single vet visit, and it can be really hard to have enough time to talk about behavior stuff when your animal's also sick and we're trying to help fix the problem there. If I don't have to explain how positive reinforcement works, if I can just say, hey, I really think we should train this behavior because I think you're going to have to do this over and over again for your bird for the rest of its life. And you can go, okay, what does that training plan look like? That's a different type of a conversation than how do I train my bird? What's positive reinforcement? I don't know how to do any of that. And it would be really nice if we were just working off the same dictionary. And again, also not having to convince people that you can do this, because a lot of what I do is saying, hey, you can train this. It's really not that hard. It's really pretty easy, because it's so scary for us as people to go and do something you've never done before. And it feels really intimidating if you don't have an example. And if you've seen some videos and go, oh, well, that's not that hard, I could do that. I think it would be really great for encouragement for people to try, because I think most of the people that I see that actually really make an effort and are like, I really want to try to do this, they have success. I don't usually see cases where it's like, well, my bird's just untrainable. It's usually like, I tried once and I didn't actually follow through. I didn't follow an actual training protocol. I didn't actually look to adjust things. I just tried once and it didn't work, so I'm done. And I think it would be really great if people, realize hey, there's actually some really good proven techniques out there that I can use.
Well, is there anything else that we didn't cover that we need to cover for people on this fear-free stuff?
I think the only other thing that I just want to mention that I think is a great thing to be thinking about, and we've kind of touched on it a couple of different times, but just the idea of trying to do training at the vet clinic and bringing birds in for non-sick visits. I just really think that's such a huge, crucial part of it. Even if you're doing the training at home, if you haven't generalized that behavior to the vet office and you haven't had other people working with the bird with the towel or having the bird, do targeting with other people, it's a huge difference for a lot of birds. And so if you can choose to see it as an investment, like I'm investing in my bird's future health and well-being, this is a way for me to help my bird's quality of life long term. A lot of our parrot species can live for decades. And if we are going to invest when they're young, it's such a difference when we're working with baby birds versus an adult that's already kind of set in their ways. The adults can still make huge strides, but it's a lot more challenging. I wish every person with a baby bird had a schedule where they were like, I'm going to go in and we're going to have happy visits for the first, at least the first year of the life of the bird. And we're going to make sure this bird sees the vet clinic coming up and is like, woohoo, that's the best place in the world. Because it changes the relationship. Yeah, it's so different. And I'd really like to see people thinking about that as part of this is part of having a new bird, that you acclimate them to the vet hospital, and we have training sessions, and this is just normal.
Excellent point. I've been fortunate to be able to do that at my veterinary clinic. They let me bring my birds in, just hang out in the empty room. So it's made a difference for sure. Good advice.
You may have to talk to your vet clinic about it, because depending on the clinic, if they're a fear-free certified veterinary clinic, they're going to know about this and they're going to be offering those types of things. If they're not, it doesn't mean that you can't do it. You just may need to talk to some people about what you're looking for and communicate what your desires are, and they may be willing to work with you. And so, just because there's not like an automated, like, of course, this is how you schedule it, it's also worth asking.
Time for your second secret word. And the second secret word is diagnostics. All right, let's get back to the program.
Well, I guess we ought to tell them where they can find the course. It is at fearfreepets.com, and I will make sure there is a direct link on the episode webpage so that they can find the exact link to the course. If they would like to take it, we highly recommend it. No, we're not biased or anything, but we do think it's a great course. And also, where can they find you, Pam Clark? Where should they go if they want to find more information about your blogs and about your consulting services?
That would be PamelaClarkOnline.com.
Great. And Alicia McLauglin, where can they find you?
Oh, I'm at my clinic all the time. I'm down in the trenches doing this every day. So I work in the Seattle area. Our clinic website is www.theexoticvet.com. We also have our Facebook page. We do a lot of posts about behavior related type stuff, and as well as cool medical cases. So follow us on Facebook. You'll find fun stuff there.
Wonderful. Well, thank you two so much. I think this was a great informative podcast, and I hope everybody will have fear-free visits for their pets and take the course on fear-free medicine for their birds. All right. Thank you, guys.
Thank you, Barbara. Bye, Alicia.
Bye.
Hey guys, wasn't that a great podcast? Dr. Alicia McLauglin and Pamela Clark have so much great information to share. We're really proud of the Fear Free course, and I hope you will check it out. You won't regret it. I also wanted to tell you that we are only 30 days away from the Global Online Animal Training Summit. And what is that? GOATS is a 2-day virtual event catered towards professionals and aspiring professionals who work with exotic animals in managed care. Now, it doesn't have to be just exotic animals. I'll tell you, we have lots of information for any kind of animal that you're working with. But the event is primarily focused on providing attendees with information designed to enhance your practical application skills and your knowledge, because we are going to do some deep dives on the principles and procedures as well. But there's a special emphasis on providing evidence-based information. I will tell you that, because we are doing some deep dives on some topics that I'm very excited about. The presenters really have been carefully chosen for their quality content and engaging presentation skills, so I'm telling you, you're going to love them. This event also features live training demonstrations from around the world. I'm really excited about this. We've picked some really quality people as well as institutions to give you some quality demos. And if you attend the live event, you also get access to a virtual swag bag and the opportunity to win some great products from our amazing sponsors. And our sponsors include Animal Care Software, Feed Pods, and Animal Equipment by Stoney. So I highly encourage you to visit the web page is atfgoats.com to learn more. You get a chance to look at the goodies that we have available for you that you might win in a drawing. This is only for our live event participants, because I do want to mention that we also have an on-demand feature if you can't attend live. We do have limited spaces for the live event, and if you go to our Facebook event page right now, there are over 860 people that have expressed interest in attending. We definitely don't have room for 860, so you want to get your space as soon as possible before they fill up. I have a feeling we're going to get a mad rush because we are in the last 30 days for this event. But in any case, I do encourage you to visit atfgoats.com, and that's where you can learn more about the topics and the presenters and all the great giveaways, learn more about our sponsors. It's really exciting. I've put a lot of work into this event, and I'm just thrilled about it. So I just want to make sure you know about that before I sign off on this podcast. It's been a fantastic podcast and a fantastic event coming up. Super glad to have you listening, and look forward to having you join me on the next one. And that's it for this podcast. Take care, and look forward to enjoying another podcast with you in the future. Bye, everybody. If you liked what you heard today, visit animaltrainingfundamentals.com for more quality content on animal training. You'll find courses, community, and extensive video examples from my consulting work around the world. We'd love to have you join our force-free family.